In this lesson, we're going to go over some highlights of developmental theories. And this is just a heads up. This lesson is going to be pretty short because we go into these developmental theories more in depth in other lessons. And the reason we want to address these developmental theories is because they give you an idea of what kind of patterns you're going to predict in your patients. They can look at things like age or cognition. They also look at some social aspects or exposures. Developmental theories are they add this level of complexity to your patients. For the most part, they focus on morality, they focus on psychosocial development and some cognitive ideals. But one of the things you're going to have to do when you're thinking about your developmental theories is you're going to need to remove yourself from the situation and think about how your patient is based on these three theories. This gives you some better insight into what to expect from your patient going forward and how you can best help care for them. There are three main players that we're going to focus on when we talk about all of our developmental theories. And the first one is Piaget. He was a psychologist. He really focused on the cognitive aspect, and that's what all of his research was on. The big thing to remember about Piaget is that his theory spanned over 4 periods. And it really focuses on this cognitive perspective. Kohlberg is another one we're going to focus on. Kohlberg focused a lot of his research on moral development, and he piggybacked a lot on what Piaget did in all of his work. The way that Kohlberg is broken up is he's got 3 levels with 2 stages in each, and they really focus on that setup over development. Erikson is going to be your last one that we go over, and Erikson is well known for his 8 stages of development. The really important thing to remember about Erikson is Erikson's research indicated that you have to master a stage before you move to the next one. And there's going to be more lessons about each one of these in detail in each lesson, so be sure to check those out. And as we go through the nursing concepts in developmental theory and on development, just remember we're focusing on human development and cognition, and then we also focused on the health promotion aspect. Now, to briefly recap, you need to know this stuff because you can expect patterns from your patients, and it helps you get a better foundation for what to expect with your patients moving forward. Piaget focuses on cognitive development, Kohlberg focuses on moral development, and then Erikson coins these theories of personality development over the 8 stages. I know this lesson was really short, but I wanted to make sure that we had some highlights in preparation for going into those other lessons. So be sure to check those out for more detail. Make sure you check out all the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.